I'm a retired GP and I suffer from Crohn's disease, and I treated this through nutritional medicine, and it was at the British Ecological Medicine Society that I met Rob. And I mentioned to him that I had this problem. I managed to deal with most of my food sensitivities, but there were two things that I just could not get rid of and had the most disastrous consequences if I had even a little bit of an orange. I remember coming and thinking to myself, why am I wasting my time? This isn't going to work. And I spent an hour and a half with Rob, and hey presto, I was able to have orange with no problems. And I couldn't believe it. It was a miracle to me. It really was. And I found that quite incomprehensible. That made an enormous difference to me, because when you go to meetings, you're normally offered orange juice. You know, it's quite difficult to get water. They offer you orange juice if you don't want alcohol. So it really was quite liberating to be able to drink orange juice again. Well, absolutely. No problems at all. An hour and a half, and that was it. And I was cured. The issue of how long the things work would be, I suppose, what I as a doctor would say, well look, yeah, it worked, but you know, what's that, how long is that for? Well, it's now 2.5 years since I met Rob, and I can still take orange without any trouble whatsoever. So I think that I can say it is reasonable to assume that that particular food sensitivity I no longer have. I think that's a reasonable statement. I can only make it in terms of my own experience. But I would definitely recommend it, and I have recommended to a number of people who have met with Crohn's that they might find it useful to come and see Rob. The other bit one could say is that it was an enjoyable experience. I haven't actually said that, but it was. I came away from there, I suppose on a high, but still very sceptical, not believing that it would work. And within a week, I was convinced it would work. Well, I took half a glass of orange juice after 3 days when I could safely take it in case it did produce this disastrous effect. And nothing happened. And the next day I had half an orange, and nothing happened. And the next day I had a whole orange, and nothing happened. And the next day I had a whole glass of orange juice, and nothing happened. And I was then convinced that it had worked. And even more complicated was the fact that later I used to have similar food intolerance to chili. And I was running a course in East London where almost all the doctors were Indian, and the lunch provided was curry, and this was 2 hours away by public transport from where I live. And I had curry for lunch, and I thought, after I had it, I thought, you're risking it, aren't you? But it was fine. And I thought when I got home, I thought, it's great. It worked. But it did. I'm fine. I can have chili now. So it worked. So it was safe. Part of it is about what it does to you as an individual, how you think, and probably at a subconscious level rather than consciously. That your subconscious enables you to be freed from this burden. That's the way I'd explain it. My view was T cells, which are the main immune system mechanism, have endorphin receptors. But as far as we know, endorphins are localized to the brain, and T cells can't get in the brain. So there has to be a substance that the brain is emitting, which is endorphin-like, which T cells can latch onto. And I believe that during NLP, this is what happens. something happens and your immune system is altered. Because food sensitivities are all about the immune system. So your immune system is altered, and it appears as if it's altered permanently. Of course, it's only 2.5 years, and maybe only after 10 years can you say almost categorically it's permanent, but it does seem to be that way. No word that could describe how valuable this has been for me as an individual. It's worth thousands. To have the peace of mind to be able to eat and not worry about the fact that you're going to be embarrassed. It's incredible. I think that NLP is safe. People are always worried, I think, about anything that fiddles with the brain, the mind. But I think NLP is actually a very safe procedure, certainly if it's somebody like Rob who's doing it, who's caring and gentle and helps you. And I think that's the important thing. It's probably a big step to move from conventional medical models to something like NLP. As far as I'm concerned, I had a single treatment for the main food intolerance I had, and that was it. I've never had to come back for that.